Dr. Brenda Katira, the country director, Clinton Health Access Initiative Rwanda, says the second International Conference on Public Health in Africa (CPHIA) 2022 will serve as a catalyst to build more resilient health systems that will allow African countries to better prepare and manage emerging health threats while also addressing long-standing infectious diseases. Katira said this in an interview with the News Agency of Nigeria while sharing insights on the upcoming conference. The conference is organized by the Africa CDC and the African Union in partnership with the Government of Rwanda and is scheduled to hold from December 13 to 15 in Kigali, Rwanda. The theme is Preparedness for Future Pandemics and Post-Pandemic Recovery, Africa at Crossroads.
We already have some resilience in our health system, but there are still gaps that the COVID-19 pandemic brought to the forefront. One of them is that really the health inequities that happen. To date, Africa is still lagging behind on vaccine coverage. I think we're not even at 30%, whereas other continents are over 80, 90% in their vaccine coverage. We had to scramble for our people to get vaccines. And surprisingly, there wasn't much vaccine hesitancy. So people were willing to get the vaccines, but the access was a problem. PPEs, our healthcare workers were going without protective equipment. It exposed the critical gaps in emergency care. I'm not sure about how you faced it in Nigeria, but in many of our other countries, it was hard to get a bed in ICU. There were countable beds. Oxygen therapy was such a gap. And so these are the gaps that COVID-19 pandemic exposed, and we have to learn from those lessons. But also, I think I already mentioned the healthcare workforce. It really highlighted the fact that we have critical gaps in our healthcare workforce. I think this is a great platform for Africa to drive the agenda setting, to drive solutions to address Africa priorities, and to rally other partners, both on the continent but also internationally, to learn from our previous lessons, to put into place frameworks and actions that are going to change health and build resilient health systems for this continent. So CPHIA, that is going to take place in December 2022 from the 12th to the 15th, is a great platform for us to have collective efforts, to have participation from all the different players that are involved, for us to share perspectives and research findings in public health. It's going to provide a platform for strengthened scientific collaboration, to share some of these innovative ideas that you're talking about. And I think it will really serve as a catalyst to continue building more resilient health systems. And the way I see it, it's not just a one-time conference event, produce a report, and that's it, because that's not going to achieve the impact that we want. It's I think, going to continue building on different efforts that have been done and create the momentum for African member states, for Africa organizations, for philanthropies, for civil society, for the whole of society, really, to continue these discussions after December. So I want to emphasize that it's not just going to be a conference meeting and that's it, but it's going to be a platform where there'll be continued exchange even thereafter.